Okay, you're good.
All right, so I'm gonna check the chart, make sure this is my patient, the right room. I'm looking for why he's in here today, and he's been diagnosed with gastroenteritis and dehydration. Knock, knock. Come in. I come in, shut the door, ensure privacy. As I come in, I'm assessing the room, make sure there's nothing hazardous around. I see that his cane is in reach. There's nothing on the floor. His bed's in lowest position possible. His call light's in reach. Perform hand hygiene and introduce myself. Hi, my name is Jonathan Jenkins. I'll be your nurse helping you today. And what's your name? Oh, okay. And do you mind if I check your wrist real quick? What's your date of birth? Okay. Do you have any... Nice to meet you, Mr. Harris. Do you have any allergies? Okay, penicillin. Okay. Do you know today's date? Okay. And you know why you're here? Oh, your tummy doesn't feel good? Feels like a lot of pain? Okay. So alert and oriented ×4. So you said you're in pain. Where are you in pain? Oh, your abdomen? And on a scale of 1 to 10, what would you rate that? 2? Okay. How long has this been going on? For a couple days. Is it off and on, or is it continuous? It's continuous. What kind of pain is it? Oh, it's like just sharp pain. Okay. Does anything relieve it? No? Okay. Alright, well, I'm just gonna do a full systems assessment. I'm gonna check everywhere, check your muscle, your skin, your hair, all of that jazz. Do you have any questions? No? Okay. So I'm gonna put gloves on. Hopefully. So first we're just gonna check your hair. And right now I'm looking for any lice, any manifestations, infestations, looking to see if it's shiny, if it's distributed evenly, and so far it looks good. No lesions, no wounds, nothing noticeable like that. I'm feeling the contour of the head, and it all checks out pretty good. I'm going to take my gloves off and throw them away. Alright, and as I move forward, I'm going to look and see that the ear is aligned with the eye. The eye is the length of the eyebrow. We can go ahead and... Do you mind if I take your glasses off for a couple seconds? Okay. We are then going to check Perla. Okay. We got Perla. We'll go ahead and put your glasses back on. Or actually, before we do that, can you follow my pen? Awesome, thank you. And then we're going to check the nose. And it doesn't look like there's any deviations. It looks like he has clear mucus, no inflammation or anything like that. And while we're at it, we'll check the ears. And there's no drainage, a little bit of cerumen, but that's normal. Check both sides. Okay. Now we're going to go into the mouth. Open up wide for me, please. Thank you. And as I'm looking for any decay in teeth, any inflammation in gums, just looking for any abnormalities. Everything looks aligned. Can you go ahead and say ah for me? Okay. Now we're just going to check your pulses real quick. So as I look at the carotid pulse, I'm going to check one at a time. +2. +2. It's regular, +2, bilaterally. And while we're at it, we'll check skin turgor, and it's appropriate for age. Just keep looking at the skin. Can I check your conjunctival sacs real quick? Okay. Those are pretty in pink. pull those back as we move down. All right, I'm just gonna listen to your heart and lungs real quick. Is that okay? Okay. And just in case, we'll put gloves on again. But before we do, we'll feel the skin temperature, and it's warm and dry and appropriate for ethnicity. I see that you have an incisional scar. What's that from? Oh, you had a surgery? Well, what kind of surgery? And whatever surgery he tells me. And, all right, we're going to just listen to your heart real quick. All right. Ensure as much patient privacy as possible. All right, we start right here. Love dub. Love dub. Love dub. Love dub. Love dub. Now we're going to check the radial pulse at the same time. Alright, it's equal and regular, +2. Alright, do you mind if I listen to your breaths real quick? We'll sit you up for that. Okay. Take a deep breath in. Okay. Deep breath in. Deep breath in. Deep breath in. Okay, now we're just going to look at the back real quick. And as I look at the back, I'm looking for any more lesions. I see that you have, it looks like 2 moles. Have those been looked at before? Oh, they have been. And has your doctor said anything about them? No, they're okay. All right. All right, and as I'm looking, I see about a 2-inch skin tear. It's covered with Tegaderm. How long's that patch been on? Okay, thank you. Now we're just gonna listen to breath sounds, and as I look at the spine and I have them bend over, it looks to be straight. Take a deep breath in. Again. Alright, and while we're at it, we can percuss the back, check for kidney pain. Does that hurt at all? No? Breathing is equal, unlabored. Breath sounds are clear in all fields. Alright, we're just going to sit you back down real quick. Put your glasses back on, kinda. Alright, now I'm just going to check your abdomen real quick. Is that okay with you? Okay. I see that there's a little bit of redness underneath the right breast. I'll check for blanching, and it is good. I see that they are incontinent of urine. And as I'm looking, when was your last bowel movement? Oh, today? Okay. Did you have diarrhea? No? Okay. Did you feel nauseous or did you vomit? Alright, thank you. Alright, as we look, the stomach is flat. There's no lesions, no veins, no scars. Now we're just going to go ahead and there's no ostomies. We're going to go ahead and listen. Active. 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 Alright, everything sounds good. Now we're just going to palpate real quick. And tell me if this hurts you at all. No? Does your abdomen still hurt? Okay, does it hurt when I press? No, okay. Alright, and then we'll percuss the bladder real quick, have them flex down, it doesn't feel distended. Alright, everything looks good there. Next we're going to, I know this might be embarrassing, but it's part of the assessment, so I'm just going to go ahead and go check your peri area, if that's okay with you. Okay. I'm going to put gloves on. I noticed that the penis is uncircumcised. When I get my other glove on, we'll continue. Alright, we're just going to lift it up, look for any redness, swelling, check for any hernias, anything of that matter, and it all looks to be good. Okay. And everything looks good. Throw away these gloves. Ensure more privacy. As we move down, we'll check the muscle tone, and it is firm on both sides. We'll check to see if they can move extremities equally, and it looks like he can bend his knees and he can extend. Can you pull against my hand? Okay, can you push? Can you pull against my hand? Can you push? Okay. Does this hurt at all when I feel your joints? No? How about down here? No? Okay. Alright. Can you go ahead and push against my hands? Okay. Can you pull? We'll check pedal pulses, and they are +2 bilaterally. Alright. And as we look down, hair is distributed evenly. The skin is still warm, appropriate for ethnicity, and dry. We'll check edema, and also it's +0. No edema present bilaterally. Alright. Now we're going to check for cap refill under 2 seconds bilaterally. Can you go ahead and squeeze my fingers as hard as you can? Okay. Grip strength equal bilaterally. Strong. Check cap refill under 2 seconds bilaterally. Still feeling joints. Does this hurt at all? No? Okay. Still checking the skin. Warm, appropriate for ethnicity, dry, hair distribution. Can you go ahead and flex your wrist? Push away. Okay, and your elbow. Okay. Flex your wrist. Push away. Push down, push up. Okay, can you go ahead and shrug your shoulders? Okay. Can you go ahead and look all the way that way? And this way. Okay, awesome, thank you. Now, we are going to check. Can you blow your face up like this? Stick your tongue out, go this way, raise your eyebrows, smile, frown. Awesome, thank you. Alright, this is the last part. We need to check your bottom. Is that okay? Alright. So once again, perform hand hygiene, get PPE. And during all of this, I'd make sure that the mattress is not soiled before I do the assessment, and if it was, I'd provide pericare. And while I was looking at the chest, I did not notice any deformities, no barrel chest. It was just flat, appropriate for sex. Alright, we're just going to turn you over. Alright, it looks like you have a Duragesic patch. skin folds away. Looking for any fissures, lesions, anything of that matter. It all looks good and clean and dry. Alright, we're going to pull you back over. Alright, take the gloves off. Alright, now we're just going to check radial pulses, +2 bilaterally. We check pedal pulses, so we're good there. I think that's about it. Sarah, do you have any other issues, any other concerns you want to talk about? No? Okay. Well, I'm going to put your call light right here. Do you want me to raise your bed? No? You're perfectly fine right here. Bed is lowered in place. Everything is in reach. If I had a trash can, these gloves would be thrown away. And everything looks good. Make sure everything's thrown away. Leave that in reach. Make sure there's no hazardous things. Ensure privacy. Shut the door. Call lights in place.